ده الأومرون سيمبوزيوم، وبالمناسبة لابد إن احنا نشكر شركة أومرون لدعمها welcome to this Omron Symposium, and many thanks to Omron for supporting our Egyptian Hypertension Society. Omron is responsible for the development, delivery, and the blood pressure measuring machines. This symposium, the first speaker, Omron-Ghada Sayed from our cardiac department at Cairo University, and she will discuss which device to measure blood pressure accurately. Dr. Ghada.
Bismillah ar-Rahman ar-Rahim. Thank you, my dear professors, for your kind invitation. Good afternoon, my professors and my colleagues. This is an Omron Symposium, and it's going to be about which device to measure blood pressure accurately. Why do we need to measure blood pressure accurately? We need to measure blood pressure accurately because the diagnosis of hypertension and the classification of hypertension depends on correct measurement of blood pressure. In addition, the initiation of therapy and the follow-up to evaluate the target, the reaching target of blood pressure control, it needs correct blood pressure measurement. That's why we need validated devices, well-trained personnel, in addition to proper measuring technique. We have many devices available in the market. The well-known and the traditional mercury sphygmomanometer, the aneroid sphygmomanometer, the oscillometric devices, and the subset of oscillometric devices, the ambulatory blood pressure measuring device, and the automated unattended blood pressure measuring device. First, the mercury sphygmomanometer. Of course, you all know that mercury sphygmomanometer is the oldest device that has been introduced to measure blood pressure since the beginning of the 20th century. And it had been the gold standard for measurement of blood pressure and the device most commonly used in major hypertension trials. The list of cons of mercury sphygmomanometer far exceeds the pros of mercury sphygmomanometer. There are drawbacks related to the personnel who measures the blood pressure. If this person has lack of concentration, if he has a hearing defect, if this person has terminal digit preference, if this person fails to interpret the Korotkoff sound, if this person is, has an observer bias towards the patient, then there will be errors which are called observer errors. Another error is the methodology error. The mercury sphygmomanometer is a device which depends on auscultatory method, and the auscultatory method is a complex method of measuring blood pressure. It needs complex training. So if the personnel reading the blood pressure is not trained enough, then there will be error in measuring blood pressure. Last and not least, the device problem. The device itself has many problems related to the calibration, the maintenance of the device, and the health hazards of mercury itself. There was an incident in 1954 in Japan, Minamata Bay. Specifically, there was a factory which dumped their chemical waste products into Minamata Bay. And people who ate from the marine life of this Minamata Bay got severe mercury poisoning in the form of peripheral neuropathy, neurological defects, failure or loss of vision, loss of speech, and in severe cases, it reached paralysis, coma, and even death. That's why the awareness about mercury poisoning was raised worldwide. This is a Minamata Convention that has been adopted by the United Nations in 2013, which forbids the manufacture, the import, and the export of any device that contains mercury. This includes the mercury sphygmomanometers and the thermometers. And this Minamata Convention has been taken into or enters into action in 2017. So what about the problem of mercury sphygmomanometer devices in Egypt? A study was conducted by Professor Dr. Salman Gharib and colleagues, And they tested the mercury sphygmomanometer devices present in 50 hospitals distributed along university hospitals and MOH hospitals. And they tested 465 mercury devices. As regards the physical assessment of the device, the lead, the rubber tubing, the rubber valve, the amount of mercury in the device, in addition to the leakage test and the calibration test. For a device to be considered efficient or validated to measure the blood pressure correctly, it has to succeed in passing all these three tests. Actually, the results were devastating. Only 6 devices out of 465 devices passed these three tests. So is it time to get rid of the mercury sphygmomanometer? Probably yes. Now the world is facing a problem of getting rid of mercury in the already used mercury sphygmomanometer device. They stopped making or manufacturing devices, but now the problem is how to get rid of mercury in these devices. Second device in the market is the aneroid device. It has an advantage of not containing mercury, so thus it doesn't carry the health hazards of mercury. It doesn't contain any liquid, that's why it's a portable device and it can be hanged on walls. But it is still a device depending on auscultatory methods. Thus, it carries all the observer and the methodology errors of auscultatory devices. And it requires more calibration, more frequent calibration. And as we said, the observer errors are like mercury devices. Recently, the oscillometric devices have been introduced in the market, and there is progressive use of these devices in measuring the blood pressure. As you can see, the list of pros is increasing. It doesn't contain mercury, thus there are no mercury hazards. It's easy to use, it's a press button, so it can be used in the office and it can be used at home. It doesn't need special training and complex training about measuring blood pressure. And some devices are smart, automated devices. They can send directly. The patient may measure his blood pressure at home and send the blood pressure readings directly to the physician through advanced techniques. But it has some drawbacks. One of the drawbacks that the different algorithms according to the manufacturer in patients who have tremors or atrial fibrillation or irregular arrhythmias in general, the readings may not be reliable and the initial price may constitute an issue. The ambulatory blood pressure measuring device is a subset of oscillometric device. Of course, it has a specific indication. It is a device that measures blood pressure along 24 hours. So it gives an idea about the short-term variability of blood pressure, the daytime, the nighttime blood pressure. It gives an idea whether the patient is having white coat hypertension, can diagnose white coat and masked hypertension. And it was found that it has a strong prognostic impact and it was closely related to the cardiovascular outcomes, but it has drawbacks as well. The drawbacks is that the device is not available in many centers. It requires special training, specific trainings for physicians who are analyzing the device, and it requires 2 visits to the office, 1 visit for the patient to put the device and another visit to remove the device. In addition, the most troublesome in this device was the nighttime inflation of the device. It causes it causes a lot of problems to patients at night, and it causes sleep disturbance. And this, of course, can affect the blood pressure and the dipping in these patients. Another device recently introduced in the market is the automated unattended blood pressure measuring device. Again, it's an oscillometric device. The idea behind this device, you can measure the blood pressure at office, but without the physician attending with the patient. The hypothesis behind this device is to reduce or abolish the white coat effect. The patient is left in a room alone with this device. The device automatically measures the blood pressure every 1 to 2 minutes, and many measurements, 5 to 15 measurements. The problem with this device is, of course, is a high cost. That's why it's not available in many centers. And it's time consuming. Every patient takes about from 15 to 30 minutes to have a reading of blood pressure. And it requires a dedicated room to the patient to be left alone. In addition to the measuring device, we should use the proper measuring cuff. The proper measuring cuff should encircle about 80% of the circumference of the arm. That's why we have many cuff sizes, starting from the pediatric, the small adult, the regular adult, the large adult, and the thigh cuffs. In addition, they introduced also the conical cuffs. The conical cuffs are specific for patients who have obese arms. In these patients, use of the square, the standard square blood pressure measuring device may overestimate the blood pressure. That's why they introduced this particular shape cuff. Now, where to measure blood pressure? We can measure the blood pressure in the office, and by measuring blood pressure in the office, we can use the mercury devices, the aneroid devices, the regular oscillometric devices, and of course, the unattended device. Out of office blood pressure measurement, meaning home blood pressure measurement and the ambulatory blood pressure measurement, we may also use the mercury, the aneroid, but of course, with all the drawbacks of the methodology errors and the observer error. And the press button regular oscillometric device, which is preferred nowadays in all guidelines, and the ambulatory pressure, which measures blood pressure along 24 hours. Why do we need to define where and by which device we measured blood pressure? Simply because the threshold for diagnosis of hypertension differs according to the device, with the office blood pressure readings being the highest readings among other devices. The ambulatory blood pressure, the daytime, the nighttime, and the 24 hours thresholds are different. The home blood pressure is similar to the daytime, and the unattended blood pressure measuring device is well correlated with the daytime, so we can assume that the threshold for diagnosis of hypertension by the unattended device is similar to the daytime ambulatory blood pressure. For the device to measure blood pressure correctly, it has to be validated. By validation, we mean it has to be accurate and it has to be precise. Accurate means that the measurement should be close to the true value of blood pressure. And by precision, we mean that repeated measurement by the device should be close. The repeated measurement should be similar in multiple readings. How to choose a validated device? Many institutions and many societies, hypertension specific societies, are now proposing different lists of validated devices. So you can go through any of these societies. You can type which device do you need. You need a device for office measurement. You need a device for pediatric measurement. You need a device for pregnant women, because each of these categories require a specific device. So you will see a list of the validated devices along the countries and the institutions online. This is an example of the STRIDE blood pressure, which is endorsed by the World Hypertension League and the European Society of Hypertension. Here they put a list of the protocols for the devices to be validated, of the effects of the validation, of the overview. They put all the details, so you can go through these details and choose the proper device for you. It was found that there are 4,000 devices in the market. Only 10% of these devices have been validated. So what do the guidelines recommend as regards the device to measure blood pressure? As we said, the mercury now is banned from most countries. So the last guidelines that recommended mercury sphygmomanometer was the Saudi Arabia guidelines in 2018. After this, no guidelines mentioned mercury sphygmomanometer. Otherwise, the aneroid devices and the oscillometric devices with out-of-office devices, ambulatory blood pressure, are all mentioned in the guidelines. Specifically, the American guidelines and the Canadian guidelines recommend the unattended office blood pressure measurement. What do the future hold for blood pressure measuring devices? Now they are testing the cuffless devices, the smartwatches, and the sports band. They have been certified by the Institute of Electrical and Electronic Engineers, and the FDA approved these cuffless blood pressure monitors, but yet no clinical trials to validate this device. And by the way, the validation of this device needs separate protocols from the arm cuff devices. So to conclude, the requirements of a good blood pressure measuring device is to be a validated and well-maintained device. You should also use a proper cuff size according to the patient arm circumference. And don't forget that a good measuring device should be complemented with a good measuring technique. Thank you.
We'll postpone the question until the second talk.
Okay.